Okay, welcome everyone. Good morning. Good morning. Thank you all for coming. We're so glad that you're joining us this morning. My name is Elise Morris, the Senior Program Manager for the Community Preparedness Program. And we are going to begin our program today with opening remarks from Tamer Hadi, the Assistant Commissioner of the Bureau of Healthcare and Community Readiness. Thanks, everyone.
Good morning, everyone. Thank you, Elise. So my name is Tamer Hadi. I'm the AC for the Bureau of Healthcare and Community Readiness, which sits in the DOHMH Office of Emergency Preparedness and Response. Welcome to our third annual conference of NYC Community Emergency Networks, which we refer to as the CENs, CENs. So I understand that over 90% of our audience today are newcomers, so thank you very much for attending. And to those who have attended this in the past, welcome back. The DOHMH Community Preparedness Program takes a sector-based approach to emergency preparedness, managing long-term contracts with a total of 7 partners to increase community resilience in the faith, human services, and community leadership sectors. And so our program today was developed and is hosted by 5 of New York City's CENs, representing the community leadership sector of our program. So every year, the CENs collaborate to plan this conference because they know that social capital plays an important role in facilitating community disaster response and recovery. The knowledge within this network is incredibly rich. We know that building social cohesion remains necessary to prepare for, respond to, and quickly recover from the impacts of disasters, whether climate-related, economic, psychological, or biological in nature. As our environment and climate is changing before our eyes, there's an increased need for community organizations to come together to prepare our communities for the intersection of multiple crises, and this is exactly what we'll be speaking about today. And so the theme for the conference today is Polycrisis, preparing New York City communities for multiple emergencies. And today our partners will speak about the challenges they face and the solutions they imagine as intersecting crises become more and more common. And so you might be wondering, what is a polycrisis? Are we experiencing one now? Have we experienced this before? Is this a new term or an old phenomenon? How is this any different? These are kind of all the questions that public health professionals, emergency managers, professors, economists, politicians, environmental justice advocates, etc. Everyone kind of grapples with that today. And I want to start off by saying that the language around this is still evolving, and we now are talking about it. So the concepts of polycrisis emerged maybe 2 decades ago and is used across a few different disciplines, but primarily international affairs and global sustainability. And so to ensure we're on the same page, I want to offer a simple definition derived from the program's research of the core themes and landscape of polycrisis. So a polycrisis is the complex entanglement of crises affecting multiple systems, often global in nature, whose combined harms are worse than the sum of those harms. So although a polycrisis can occur on a global scale, its impact is unique to its locality, environmental, social, economic, political, etc. And so today, our partners aim to ground you in how polycrisis manifests and how to address different facets of a polycrisis at the local level. And so I'd like to end by saying thank you to the CENs. Thank you for your leadership and your passion and your planning to bring this to fruition. Thank you to Lou Rivera, the Director of Community Engagement and Response Unit here in OPER, and all of the staff for really making this happen today. And thank you for having me. I've been doing this just for under a year now, and it's a pleasure to be working with this team. And so without further ado, I'm going to pass it back to Elise Morris, who is our Senior Program Manager of the Community Preparedness Program, and we'll kick off the rest of this day. Thank you very much.
Thank you so much, Tamer. We appreciate your presence and your words and setting the ground for our conference today. So let's get started. Our first presenters will be Dr. Angel Palermo and Gloria Ali-Salid Lewis, representing the East Harlem COAD. The East Harlem COAD emerged from the East Harlem Emergency Preparedness Collaborative, becoming its own entity in 2015, about a year after the 2014 gas leak and building collapse on 116th and Park Avenue, which is a very pivotal moment. The East Harlem COAD is now a coalition of local organizations, businesses who work work to prepare for, respond to, and recover from disasters that affect the lives of the East Harlem residents. So I'm just going to hand it over to our presenters today. Thank you so much.
Thank you, Elise. And Gloria, when you're ready to share.
Sorry, okay, so I'll speak to you later. Okay, bye. I don't know what else to do. Okay, I need to present.
Okay, good morning, everyone, and really thank you for the opportunity to be a part of this important event to share some important information and what we're doing across the city at the hyper-local level and community settings to prepare our most vulnerable communities. I'm Angel Palermo, and I'm co-presenting with my colleague Gloria Alacet-Lewis. We want to just focus in on this whole notion of polycrisis, but as it relates to financial stability versus financial instability and what that might mean, and really bring that to the surface as a priority area, as a concept in emergency preparedness. Next slide, please. So our colleague Tamer Hadi provided a very broad definition of what is a polycrisis. And we want to zoom in a little bit more and offer, keep reiterating what we mean by this, because as he said, it's a sort of a fairly new concept and way of thinking in emergency preparedness, but we'd like you to think about it as a situation where multiple serious crises are occurring simultaneously, and that they really impact like in a profound way when it all happens at once. And so, these crises are intense, and some of the ways in which we probably have already experienced this in our lives has been a combination of where there might be like a pandemic, right, combined with natural disasters, events with perhaps a financial or economic downturn, and all of these things really makes life complicated at the individual community level, really complicated and overall very challenging to manage. The next slide will just sort of zoom out as Tamir's comments had sort of alluded to, like when it's happening globally, there's a bunch of factors that are at play that we don't really pay attention to at the hyper-local level, at the community level. But the point of this slide is just to make the point that everything is connected. All the events, whether they're political, economic, or social nature, are connected and have a ripple effect. But inside of a polycrisis concept, what is not explicitly included and talked about are the isms and specifically the ways in which what we call forms of structural violence, like explicit racism, generational poverty, generational trauma, income, educational equality. Those are crises that unfortunately are persistent in our communities, particularly our communities of color and historically disadvantaged communities. And so we want to name that in the East Harlem COAD. We recognize, next slide, that communities of color are particularly impacted by polycrises that are not well named and explicitly defined. And so we just want to highlight a few ways in which we believe in East Harlem, and I think similar to other communities, that polycrises impact neighborhoods like ours more severely than other neighborhoods that may have other types of resources. So in the realm of health disparities, there's no accident that we have a health action center to address a high burden of disease and illness. That is because we know that when polycrises are at play, we may suffer more because of our pre-existing health conditions and have limited medical support. Housing insecurity is another dynamic that will play out. Many people of color live in areas with fewer resources and support. We happen to live in a neighborhood that has this, one of the highest concentrations of public housing developments that comes with its own set of disadvantages around high quality living environments. Discrimination and racism is another circumstance that is associated and gets exacerbated in times of polycrisis. And this can lead to unequal treatment and emergency responses and recovery efforts. And we felt that in East Harlem during the pandemic. We were one of the first communities in New York City, Manhattan, to have the highest positive test rates for COVID, and one of the last to get sanitizer and face masks. So we recognize that experience. And then lastly, financial instability. During a polycrisis and like economic downturns, we can really be struggling financially on top of already the systemic racism that communities of color have historically experienced. So with that, I'm going to turn to Gloria, who's going to highlight some of the ways that we can be financially stable in these times.
Thank you very much. Again, happy to be here with everyone. Just jumping into what a financial emergency could be, it's any unplanned expense or loss. It could be a missed paycheck or a partial paycheck or a damaged roof, a flat tire, an unexpected medical bill, or an unexpected loss of a loved one. Any of these unexpected planned items would conjure a financial emergency. So what do you do? Where do you start when the odds are stacked against you? And where do you start? Where do we start just as a whole in getting this together? How to be ready in emergency. I've gathered 5 different areas that I think it's important to have: and storage of important documents, protecting your assets, knowing your numbers, starting to save, and to me the most important is increasing financial literacy overall so that we can be prepared for these things as they come up. Keeping important documents can be anything. It's keeping it in a binder, keeping these things in a fireproof safe, anything that can be uploaded to a cloud. This would be insurance policies, understanding your insurance policies, right? Copies of identification, birth certificates, important documents, living wills and medical proxies, last will and testaments, and any financial statements and any passwords you can put in a safe place to have something that you can grab and go or something that would remain safe. Protecting your assets would kind of go under insurance, right? This is when we want to look at if you have a car, having auto insurance, having health insurance if you through your job or through the ACA provisions. If you having life insurance, it's very important to have home or rental insurance if you own a home or if you're renting an apartment. That would cover things that your landlord wouldn't cover, as such as theft or even if you have a power outage, it would cover the food that you've just stocked in your freezer, right? Having long-term disability insurance. This would kick in after short-term, and this would cover sicknesses that are not affected by work, that do not occur at work, but outside of work. Long-term care insurance, if you need help at home, getting dressed, just with the daily things. And this is usually added on to an existing policy. They don't really sell this individually, but it's something to, right? Identity theft protection. You can also do this by monitoring your credit, signing up for one of the credit bureaus, and it's free to monitor your credit. So you get alerts when, a new account has been established, a new inquiry has been put in your account. So you'll know right away if this is you or not, right? And at minimum, if you don't have life insurance for you and your family, you should at minimum have burial insurance for you and your family. You can have that for children up until $10,000 a piece, if I'm not mistaken. But this is important. These are the things that we don't plan, right? We see GoFundMe a lot on social media platforms as an insurance measure, and it's not, And very important to have guardianship instructions for your children. If you have school-age children, children under 18, or you take care of adult parents or adults with disabilities, you need to have a plan of action. And you need insurance if you have anyone who's dependent upon your salary. So if you don't have anyone who's dependent upon you financially, then you may not need insurance, burial insurance, but just to know these are the options that are available. Knowing your numbers. This is knowing your budget, knowing your monthly expenses, knowing what the needs versus wants. So in column 1 would be like our regular budget, but in an emergency, what can you cut? What are the ones we can cut, like monthly subscriptions and fund money and, going out, and where we have extra debt payments, those would be cut. So here, having a plan to know, in an emergency or a time I have to downsize, I know 1/3 of my budget can be cut. It's knowing those numbers off the bat. Starting an emergency fund. You hear every financial person says, save 3 to 6 months of expenses. That's not always realistic, right? Let's start small, start with $500. Even if $500, that would cover maybe a day or 2 missed work or 3 days missed work, if you don't have PTO. Maybe then going to $1,000 for the equivalent of 1 paycheck to help you get through anything that's unexpected, maybe a missed paycheck, or like we covered earlier, any, a car, something with transportation, something with the home, something that would impact. Most emergencies are these smaller amounts that could really impact each paycheck. Opening a separate account for this so that you don't see it, it's going somewhere where you don't touch it, don't have a card associated with it, if you do leave it at home. And making these routine automated payments, getting into the habit of making these routine payments when the time is not crunch time. So if you have to get a side hustle or get to save extra money, have the urgency now for these savings, as opposed to when an emergency actually occurs, then having to, maybe get a second job, and maybe you won't be able to at that time. So have that urgency now to put the savings in place so that you can be rest assured that we can't predict every emergency, right? But we can try to be as best prepared as we can. And financial literacy is the basis for all of these. If you don't have this, it's going to be hard to even plan. And I feel like in our communities, financial literacy is really lacking. And even as I was trying to find additional resources that would be free and available, it's limiting in New York City. So we have to do more in trying to get more financial literacy available. Financial literacy covers all of these areas, right? To give us confidence enough to be able to make financial decisions for us and our family. It gives us the knowledge and the skills base and answering these questions: how to open a bank account and how to spend, how to budget, how to manage credit cards and debt management and loans, you know, the different types of insurances, how to pay taxes. Am I supposed to pay taxes? You know, when can I retire? Can I retire? And how to discuss this finances within relationships. How do we discuss with our families? But all these questions have to be answered, that you need this foundational knowledge in order to do so. Something as simple as what's the difference between a PPO and an HMO when selecting health insurance, you know, FSA, how to fill out the W-4 completely. These things are covered in financial literacy and definitely needs to be the basis. And continuing, this is continuing knowledge. You know, you don't just learn it once, it's something that you're always feeding yourself so that you can be prepared in the event of emergency. So what do we do during a financial emergency? Trying to keep a positive, solution-oriented mindset. It is not that easy, but the more we practice it, if we stay in a solutions-oriented environment, it will try to keep that anxiety down and keep the worrying down and just trying to stay positive. That's the best thing that we really can do. Listing out the necessary expenses and prioritizing, right? Utilities, rent, mortgage, and food. Those three, if you are really strapped, this is the areas that you want to focus on. And this is when you would use your emergency savings to cover this, right? Some people, when you lose a job, it takes 3 to 6 months on average to replace that salary, right? So we want to start using what we have saved. You contact insurance companies if your damage is home damage or car damage. You file your necessary reports and take photos and call the companies. Ask your creditors and lenders about whatever programs they may have. Do not avoid it. They usually have programs in place where they'll either freeze payments or freeze late payment fees, or have your bills due at another time. Work change your pay date. So if you have a credit card and it's due on the 5th of the month, ask them to change it to the 25th every month. They really do have programs to work with you. Just ask questions, tell them your situation, ask questions, what do they have available? And then research community government resources, right? I believe that utilities, they have a winter heat program. So if you're having trouble around October, they will not disconnect your utilities between October and April. Ask them, they will freeze it. The bill will still accumulate, but it will not be due when you're disconnected. Talk to them and find out. Following unemployment and then other temporary housing and food assistance. How do we rebuild after a financial emergency? Again, keeping a positive mindset, prioritizing expenses again, filing any insurance claims that you may have needed to file, and then start back saving again, start back small. Don't worry about, you know, it can seem so huge at the time, but just start small again, $500, $1,000 until you have something substantial set to the side. Seeking professional help. These were some of the sites I've found that can help with credit counseling, debt counseling, and below that was anything that has to do with financial literacy. Easy, digestible sites like Money Coach, I really feel is a great tool. They're on YouTube, and they also have a website. Very small, digestible chunk videos, 3 to 4 minutes with questions and answers, which I think would be really helpful. They are animated illustrations, but they are very digestible and easy to consume the information. And I think that's where we are. But thank you.
Thank you. Thank you, East Harlem COAD. This was a very relevant topic. Thank you so much to Dr. Angel and Gloria. They put their contact information there. That was, correct me if I'm wrong, Angel, it's eastharlemcoad@gmail.com. If you can put that in the chat,
Will do.
that would be great. Okay, great. And we will repost those links. As if you can repost those links, that'd be great. Okay, great. Thank you so much. So we're going to move on to our second presenter. Our next presenter will be Southern Brooklyn COAD. This coalition was formed after Hurricane Sandy. which wreaked chaos on the Southern Brooklyn region. The objective of Southern Brooklyn COAD is to prepare its residents for impacts of emergencies and disasters and coordinate response and recovery efforts. So I'm going to hand it over to Southern Brooklyn COAD. Thank you so much.
Larissa, would you like to bring the slides up? Pull the slides up. Thank you, everyone. That was a terrific presentation. We really appreciate that, East Harlem. You really set us up for our presentation. We are Southern Brooklyn COAD, as was mentioned. We are a coalition in and around the Coney Island Peninsula in Brooklyn. My name is Laura McKenna. I'm the lead for the coalition. I am here today with Marina Meister, who is our deputy lead, and also with us is the executive director, Larissa Boaz, who is with Shorefront JCC. She is going to present a case study involving how food insecurity escalates as emergencies are compounded. Next slide, please. Go ahead, Marina. Marina, unmute.
I'm sorry, here. Yes, hi, everyone. So what do we mean when we talk about food insecurity? It's this inability to provide adequate amount of food for yourself or your household members due to a lack of resources, whether it's financial resources or resources of other types. Next slide, please. The factors that contribute to food insecurity are various, and so some of these it's poverty and income inequality, high cost of living, unemployment and underemployment, immigrant communities, limited access to healthy food, and it's also a part of a wider discussion on systemic racism and discrimination. Next slide, please. So having enough access to nutritious food is such a vital need that when that need is not met, it truly impacts every facet of a person's life, both physical and mental. So your overall health, the way you perform at work and in school, it affects your social relationships and the way you approach financial decisions. And now I'm going to pass you to Larissa Boaz, who is going to talk to us. She's going to present us the case study of her food pantry that has seen an unprecedented rise in demand due to a series of emergencies. Thank you very much.
Hi, everyone. I'm Larissa Boaz. I'm the Executive Director at the Shorefront Jewish Community Council. Today, we're going to spotlight our food pantry in the context of Polycrisis. The Shorefront Jewish Community Council was founded in 1981. We've been located in the heart of Brighton Beach ever since. We're an organization that fights poverty through a myriad of social service programs that we provide directly, and we bring in partners to help us provide the services through a one-stop multi-service center. Brighton Beach is a seaside community. It's multicultural. It's known, or historically has been known, as Little Odessa because of the large influx of individuals from the former Soviet Union and of late from the Ukraine as well. There are many Jewish, Hispanic, Asian, Pakistani individuals. It's quite multicultural. By and large, it's a community of older adults historically. And this area was pretty hard hit after Hurricane Sandy in 2012. So today we're going to focus on our food pantry and our food programs in the context of polycrisis and multiple emergencies that either happened simultaneously or concurrently over time. And those will include the pandemic, COVID-19, the war in Ukraine, the bird flu and how it affects food products, and a myriad of weather emergencies, everything from the Canadian wildfires, heavy rainfalls and flash flooding, and extreme temperatures, both hot and cold. So before the pandemic, this community was high needs to begin with. Going further south towards Coney Island, we really see a huge food desert with limited access to produce and chain grocery stores just virtually non-existent. It's a community of seniors for the most part that live on fixed incomes, and there were many pantry limitations. So the first escalation that we saw was COVID-19. When the pandemic started, our pantry, which was a digital pantry, really needed to shift and figure out how to provide services in a safe environment. So we moved from digital to providing everyone the same package in order to be able to ensure that our volunteers were safe in the packing of the products and in the distribution. During the pandemic, there were numerous effects to foods across the nation, right? We saw supply chain disruptions. Restaurants were heavily impacted, and indoor dining became virtually non-existent. There was an increased demand for food assistance, and we saw shifts in consumer behavior. People were shopping online, looking for home delivery options, and price increases for perishable and high demand food items became prevalent, and very often there was a lack of supply in important items. So the government really stepped up during this time, and we saw meal delivery programs like Get Food NYC. There were free meals to students. There was an additional pandemic benefit that was added to EBT. Soup kitchens and food pantries received additional support, and there was a global public awareness campaign that happened so that New York City residents could know where to access food, how to access food, what resources were available. When that support ended, it really caused a lot of strain for many. So access to nutritious food decreased. So for communities that were food deserts, they were limited in the resources that they had available again. It created additional financial strain. The existing inequities and disparities just exacerbated, and prices stayed high for basic staples, right? We saw greedflation. Companies were able to charge a higher rate for items that consumers would still purchase despite the price increase. So this put an overall demand on food pantries and food programs. We pivoted during this time and during the pandemic overall to increase community awareness about our programs and services, especially as our office resumed operation post-pandemic. We collaborated with funders and food suppliers to make them aware of the growing need in our community, and they in turn provided additional resources to help us meet that need. We partnered with another organization and had on-site community health workers to help us deal with the increased demand, and organized events like health fairs to respond to needs in the community. And we adopted new technologies. Through all of this, we saw increased utilization of our food pantry. The war in Ukraine was another escalation that was quite significant in our pantry. We started to see an influx of folks initially from the Ukraine, trying to get out of a war-torn area, and then we started to see additional neighboring countries also seeking refuge. and particularly settling in Brighton Beach due to the conveniences of the community. And this put pressure on our organization, especially the pantry. We saw people in the country for 3 days and already in line and looking for support. Our food pantry responded in a number of ways. We consolidated from 2 locations into 1. We hired bilingual staff and recruited even more volunteers. We looked at our operational workflows and reorganized our space to be able to improve efficiency. And we went back to our digital ordering system with client choice so that they choose the preferred items for their family. And we have pickup and started a limited delivery program for the homebound and disabled individuals that could not visit our pantry. The benefits to our clients is that there are shorter wait times, there's less food waste, clients have a more dignified experience, and we were able to serve significantly more clients. What you can see in our progression in 2022, we served slightly less than 10,000 people. We're projected to serve 36,000 people this year, and next year even more. So what were the lessons that we had from all of this? We looked at new modalities for outreach, including digital media, utilizing robocalls and mass texting, not only in English, but in our client population's preferred language. We are focusing our services around our clients, whether it's our client choice food pantry, ensuring that we have culturally and linguistically competent staff and volunteers. And finally, utilizing digital platforms to track and provide our services improves our accessibility to our client population and enables us to optimize and connect our digital systems with other platforms like a messaging system. So we're able to integrate much more seamlessly. From here, I'll give it back to Laura.
Thanks very much, Larissa. So just a couple of points in conclusion, after having heard from Larissa and how they handled escalating food insecurity in Brighton Beach. And that is the silver lining, if there is one for food escalation in this case, is that Shorefront JCC was pushed to find some new ways to communicate with the community, particularly with the non-English speaking community and the most vulnerable in the community. And the silver lining for us as an emergency coalition is that if we have to do emergency communications, for example, that area has water on 3 sides. If there's an incoming hurricane that could threaten everyone with flooding, then Shorefront JCC already has deep reach into the community as a trusted messenger and multiple ways of reaching that population in the event that they need, for example, to evacuate, or if there's some other emergency that's incoming. And what that allows us to do as a coalition in collaboration with New York City Emergency Management or Department of Health is that we can amplify those emergency messages that come to us through Notify NYC or other reliable sources of information, and then we can push that out through the COAD, and then our members like Shorefront JCC themselves will push it out to their clientele. Next slide, please. So, yes, this was a high need community and continues to be a high need community. And I think all of the organizations here on this call serve high need communities. But the truth is that any of us could be affected by food insecurity. They're talking already, we're getting warnings about Canadian wildfires that have started in Western Canada. That's something we all dealt with last year, made it difficult to go out, especially if you had respiratory issues, COPD, asthma, etc. And that did impact the operation of these pantries if people were not able to go out and volunteers don't want to show up. Also, extreme heat. That's another reason people don't want to come out. It puts pressure on pantries, but also it puts pressure on anyone who doesn't want to go out into that extreme heat. And then, of course, there are power outages. We're looking at Houston right now. 500,000 people are without power and dealing with heat. So they've got their own multiple emergency happening. This could happen to any of us. So with that in mind, what can we personally do? Well, we can all have water on hand. That would be a 3-day supply of water on hand, of bottled water for everyone in our household. If you can't do a 3-day supply, 1 gallon per day for everyone in your home, because you don't have the space or whatever, you do what you can. Also keep non-perishable foods on hand. Again, a 3-day supply of, for example, canned goods or dry goods or staples, other things that don't require cooking, special preparation, water in case any of these are taken out. And finally, pets, don't forget them. Keep us an extra supply of food and water available for them as well. So this concludes our presentation. We thank you very much for your attendance. If you would like to contact any of us, you can reach the Southern Brooklyn COAD through our website, which is southernbrooklyncoad.org, or Shorefront JCC at shorefrontjcc.org. Thank you.
Thank you so much. Thank you, Laura. Thank you, Marina. Thank you, Larissa. Thank you, Southern Brooklyn COAD, for presenting on food insecurity. Again, if you have any questions about any presentation, please feel free to put it on the chat. There'll be some time for Q&A at the end as well. Okay, thank you. So next up is Michelle Bascom, presenting on behalf of the Staten Island COAD. The Staten Island COAD was founded The Staten Island COAD was founded in the aftermath of Hurricane Sandy to improve communication and coordination between local leaders and organizations during response efforts. Today, the coalition's mission is to better prepare Staten Island community organizations for future disasters and everyday emergencies through education, situational awareness, and communication that is responsive to community assets and vulnerabilities. Thank you so much. Here is Michelle Bascom.
Thank you so much, Elise. Good morning, everyone. Thanks for joining us. Apparently we're jumping right in. Our focus today will be on mental health. Again, my name is Michelle Bascom. I serve as the director of the Staten Island COAD in my role as director of programs and development at nonprofit Staten Island. Similar to the other COADs, we are a local support for readiness and response. And I always just like to lift up and kind of emphasize that our mission is really focused on better preparing Staten Island community organizations. We know that those who serve are those who will respond, and they are also the neighbors of those who are impacted, if not experiencing impact themselves. So we work alongside our borough's LTRO, who is a bit more resident facing, and we really emphasize education, situational awareness, communication, assets and needs work for local organizations who serve our communities. We've heard a lot of great lenses and examples of polycrisis already, and so I don't want to belabor the point, but I'll put it into a frame for our purposes here. We've heard that polycrisis is this complex entanglement of multiple crises occurring at one time. They can be as large as global in nature, but really the impact is unique to the locality, to the community. So environmental, social, economic, political fallout we tend to experience based on the character and culture and existing landscape that we reside in. So for example, for our purposes, we think about climate change is resulting in extreme weather and geological events that are impacting communities across New York City, while those same communities continue to respond and recover from COVID-19 and other long-term public health implications and issues. While many of those communities who are disproportionately affected, as we've heard already this morning, tend to face housing insecurity, financial insecurity, food insecurity, and often are inclined suffer from impact, but also inclined to respond to real deep need for social justice. When there's civil unrest, we see that impacting these communities. So when we take those incidents together and throw a flood in there, right, that community then floods, you already have a community highly vulnerable, that's already facing financial effects and has now had these exacerbated challenges to respond with some resilience and with good strength and infrastructure. So at SI COAD, we argue here today and also really bring it to our work that the state of mental health in our borough particularly, but really citywide, statewide, and across the country is both a contributing and resulting element of the polycrises that we're experiencing in the 2020s. And that's really how we see polycrisis work in New York City. The mental health crisis that New Yorkers are facing, which we see a little bit of on the next slide, the mental health crisis that New Yorkers are facing really does impact the local capacity to respond to additional incidents and compounding emergencies with resilience, while also being in many ways a crisis unto itself. So 1 in 5 New Yorkers, here this statistic from the Mayor's Office of Community Mental Health, 1 in 5 New Yorkers experiencing a mental health illness in any given year. Really important statistic for us in our borough, because if you actually took that population number as a number, it's about 350% the population of our borough. So we see this as a really widespread issue citywide, this mental health challenges, but we know in our borough it's adversely affecting residents day to day. And so we want to be really mindful of that as we do our preparedness work and also if and when we're activated for a response. We saw from again, the Mayor's Office of Community Mental Health, just last spring, starting off last spring, almost 32% of New Yorkers reported poor mental health. And this was significant because that's really not any particular improvement from when we were 1 year removed from COVID. So May 2021, we saw 32% reporting, and then 2 years after that, so 3 full years really removed from what we would all consider the start of COVID or those lockdowns, we see that there hasn't been much progress in addressing the mental health needs and challenges that New Yorkers are facing. When we talk with our COAD members about this, we heard loud and clear that a lot has been done, but also it feels like not much has been done. And that's really this top point here, bewaring the apathy effect. We had a call from many of our members to really start taking action on the mental health needs, not just saying it's a problem, but really kind of thinking through what local solutions might look like. Adequate healthcare, big workplace anxiety for many in our borough, and also affects their ability to serve communities who themselves don't have access to healthcare in ways that would cover and address mental health, whether preventative or treatment-based. Our nonprofit's really looking for an advocate, and just really we're grateful to be invited to a space to talk through some of these challenges. That space was a series of focus groups. Our COAD was really aware of the fact that neighbors and networks and responders were all these kind of unique populations and demographics that are impacted by this current mental health landscape, I guess, for lack of a better term, affected by mental health challenges, but also being responsive to those challenges among one another and for their neighbors and for the general public. So we hosted focus groups to try and learn more about what the best practices are and what the recommendations are for improving stronger mental health and particularly building resilience within our communities. We aim to engage 20 folks. We talked to 60, which was wonderful. And that was really a cross-sector initiative. And you'll see those little icons at the bottom represent like education, small business, big business, grassroots CBOs. We spoke with public officials. We spoke with some folks in the philanthropy space, some who are mental health professionals and clinicians themselves, some who do violence prevention work. So we really tried to engage a diverse group of neighbors and networks to really unpack what we have and what we need. And assets and needs was really a great kind of first level takeaway, surface level takeaway in some ways. We found that in our borough, we do have training, but a lot of folks noted that it's really 101 style training. We do have buy-in from multiple sectors, as we saw just in the turnout, but also our participants noted that it does seem there are collaborations going on across sectors, so public, private, and nonprofit, and that there's good peer support in a lot of our organizations. As a result of those things, peer support, cross-sector support, and a good amount of training, we seem to, as a borough, feel we've made a good progress on destigmatizing the conversation around mental health and have been investing more locally in addressing social determinants of health, which is really critical. Some of the needs, though, that emerged were really sustained funding and that health insurance investment, in addition to appropriate space for service delivery. A lot of organizations, whether they were clinical, non-clinical, or otherwise, noted that it seems that in many ways there's really nowhere to go, quote unquote, nowhere to refer folks to, where their own organization wants to offer these services to the public and doesn't have adequate space in their facility or in their community to do that. And then there was conversation, which we're not going to dive into today, but I welcome a follow-up if anyone is interested, about leveling the playing field really across CBOs who do and are looking to do mental health work. And that's a real sustainability point as well as a point about credible messengers. But it would deviate a little bit from our purpose today. Our purpose today is to look at mental health again in this lens of crisis and say, is it a crisis? Well, we can define that by looking at something really concrete. Crisis occurs when a community of people perceives an urgent threat to their core values, life-sustaining functions, and there are conditions of deep uncertainty. And so when we look at this working definition, we're inclined to say yes, mental health is a crisis in our borough because we have communities of people and sub-communities of people who are particularly concerned about mental health illness being untreated, unidentified, and there not being any real promise in terms of some of the initiatives that have come to the borough. There's not been much, as I said earlier, like action, right? Follow-up. We do focus groups, but then what? And we're not the only provider, of course, to have called those types of groups together. So when we look at mental health, and think about it in this fold of polycrisis of flooding, natural disasters, cybersecurity, God forbid, active shooter incidents or other mass casualty incidents. These are some of the vulnerabilities our COAD is really concerned with. And when we plug in mental health here, we remember that these communities will believe what they experience. And so every incident may have a different impact in a different place, but if there are pre-existing needs, mental health challenges, insecurities, as we've heard earlier, we know that that crisis will affect people that much more. And in a crisis, people will process that information differently than they would otherwise. During a disaster, we see pretty unique psychological barriers that might interfere with the response, that might interfere with the opportunity for a swift or smooth recovery. Quickly, common patterns that we see: uncertainty, fear, hopelessness, helplessness, and denial. I think that this is not a surprising list to anyone, but we found it really important to name that this is what a community may very well go through when an incident, whether it's an emergency or a large-scale disaster, whether it's natural or man-made or human-driven, this is something that we might expect our community members to experience. Behaviorally, they may be looking for special treatment, which, as we've heard, we have access issues kind of already. There may be this negative vicarious either trauma or rehearsal, and that could be for responders or providers or folks who see stuff on the news. If a hurricane, for example, when we had Sandy, took out a Staten Island community, so sad, you might be a Staten Islander not at all directly affected by Sandy, but see that and resonate with that being so local to your borough, that you then start to develop some of these trauma symptoms and mental health challenges. So what do we propose? What's the takeaway here, or what are our next steps as a COAD? Well, we look at mitigation and resilience building in kind of this three-part approach. And firstly, we're focused on cross-sector planning. And this is something that I think we can see replicated in any and every borough. Do the stakeholders of your COAD coalition, whichever coalition that may be, do those stakeholders really understand the implications of polycrisis, first and foremost, because as we're hearing today, these compounding crises are unfortunately a bit of a norm. And do those stakeholders understand the implications of mental health? For our COAD in our focus groups, we did get some best practices. This was a real target deliverable for us, and we were grateful to walk away with 5 documented best practices from those 60 folks who participated in terms of what makes for effective mental health service provision in our borough. And again, I don't know that anything on this list is particularly surprising, but I do think that it's worth naming and for folks to be able to bring back to their own networks and put into perspective, are your providers working with and delivering services through credible and qualified practitioners? Do employees who would ultimately be responders have adequate access to their own care, whether that's physical or mental health care? Are there stress relieving outlets, spaces, practices? Are there good policies in place at organizations and protocols for actually supporting the mental health of that team in that workplace? And building the internal capacity, some organizations noted this, it may not land the same with everyone, but being able to have staffed practitioners at your CBOs, at your grassroots groups, or working directly with a clinical partner for whom those employees can then have a trusted space to be referred to if they themselves are suffering from some mental health challenges. This is, for us, really critical to the mitigation and resilience building, because this is work that can be done now while we're in whatever degree of gray sky, or excuse me, blue skies we might be in. This is something that organizations can set to work on collaboratively to build up their planning and mitigate against future harm. The second takeaway here was centralized advocacy, and that could be just education, educating yourself, educating your constituents or your staff, your colleagues on policies and laws, guidelines, those best practices. And if they're not in place, maybe start putting them into place. Recommendations that came to us from the focus groups, you'll see advocacy repeated here. It seems like there's really an appetite for a centralized voice that can bring providers together and bring community service organizations together to really promote greater sustainability in their own operations, in the mental and emotional and behavioral service and supports that they already provide, and advancing equitable health access for us, borough-wide, but I trust that this may land with some other communities as something that's really needed. And what might we advocate for otherwise? Investments in CBOs, those credible messengers, those who are serving and founded in underserved, resourced communities, and also in the development of the workforce for those communities, because I think it bears repeating. Oftentimes, those who serve are also residents, right? So they may be staff members, but they're residents and they're likely to be impacted as well. And upskilling came up a lot. I mentioned earlier, it's an asset in our borough that we've had a lot of destigmatization awareness work going on. We've had a lot of kind of 101 level, mental health, stress management, emotional resiliency building. But what we're hearing is that communities, and particularly those who work and serve in the community, are really looking to upskill and maybe not become clinical practitioners themselves, but really be able to apply some advanced strategies when they're serving the communities, and particularly in times of crisis. And then the final takeaway here was cross-sector response. Similar to planning, are you engaging folks from across multiple sectors to actually respond to the current pressing needs? And then can you call on them, hopefully, because they were in your planning as well, right? Can you call on them, and will you call on them if and when a future emergency or disaster strikes that we know is likely to exacerbate the mental health challenges and needs of those who are served? So that's our 15. I'm going to keep it there because otherwise I'll keep going. Thank you all so much for the time this morning. I look forward to any questions or follow-up chats that folks would like to do. My contact info is on the screen, and I'll drop some in the chat as well. Thank you.
Great. Thank you so much, Michelle. Thank you so much, Staten Island COAD. All our COADs are so rich in knowledge and understanding. Being educated about and providing mental health support during crisis is extremely important. If anyone's been working in the field for at least the past 3 years, we know this experientially. So thank you so much, Michelle. Again, if you have any questions, please drop it in the chat. We're documenting them, and we'll have some time for a little Q&A at the end. Okay. Thank you. Our next presenter will be from FRANC, the Far Rockaway Arverne Nonprofit Coalition. The Far Rockaway Arverne Nonprofit Coalition is a unified collective that works to improve the community for and with youth by strengthening Rockaway's nonprofit network. They also provide trainings, and they focus on community resilience and recovery through their Queens Resilience and Recovery Committee. So I'm going to hand it over to FRANC.
Good morning, everyone. I'm going to share my screen. Okay. Good morning, everyone. I am Vanessa Ferguson. I am FRANC's Broadway Arverne Nonprofit Coalition's project manager. Today, we're going to talk about psychosocial support and crisis response, which is addressing psychological and emotional impact of managing multiple crises on emergency responders and affected communities. Our topic today sort of ties into Staten Island as far as support in dealing with polycrisis situations. So we'll talk about several additional methods of psychosocial support. With an overview of what we have in this presentation, we'll explore the critical role of psychosocial support in crisis response. We'll delve into the psychological and emotional impact of managing multiple crises, discussing strategies for providing psychosocial support and promoting self-care among responders and fostering resilience among both responders and community members. So before we dive in, let's define psychosocial support and its purpose. Psychosocial support refers to the provision of psychological and social assistance aimed at addressing the emotional, mental, and social needs of individuals and communities affected by crisis or disasters. Its purpose encompasses various interventions designed to promote well-being, resilience, and recovery. Now, before we talk about the various interventions, let's understand the importance of addressing psychological and emotional impact. With its significance, the psychological and emotional well-being of both emergency responders and affected communities significantly influences the effectiveness of crisis response efforts and the long-term recovery process. Ignoring these aspects can lead to prolonged suffering, decreased resilience, and hindered recovery. This is a visual of the impact of COVID-19 and the steps to recovery. We will touch base on some of the recovery methods mentioned in this display. Let's briefly discuss the impact of multiple crises. Emergency responders and affected communities endure profound psychological and emotional effects amidst multiple crises. With an in-depth examination of the statement, emergency responders face overwhelming challenges, including exposure to trauma, long hours, and high-stress environments. Similarly, communities affected by crisis experience disruptions to their daily lives, loss of loved ones, and uncertainty about the future. We will now address some common responses experienced by both responders and affected communities. The toll of multiple crises often results in a range of psychological and emotional responses affecting individuals and communities alike. Some of these are stress, anxiety, depression, and PTSD. These reactions can manifest in various ways, impacting mental health and well-being. They may also have long-lasting effects if left unaddressed. And here we just have a bubble that we found on the internet with different stress factors and different feelings of that happened with multiple crisis. Some of the real life examples of events that overwhelmed emergency responders and community members are Hurricane Katrina in 2005 and the 2019-20 to 2020 Australian bushfires. We also have sources with personal accounts of emergency responders. Some of these sources are the National Center for PTSD, which is the ptsd.va.gov website, the International Association for Firefighters, that's IAFF. And then we also have the American Psychological Association, which is APA. And last but not least, the Psych Central for Firefighters and PTSD. We will now address strategies for providing psychosocial support. There are 3 relevant strategies with providing support, which are training and education for responders, establishing support systems, community-based, and number 3, community-based interventions. We'll delve into training and education for responders. Providing comprehensive training and education programs for emergency responders will equip them with the knowledge and skills necessary to recognize signs of distress, provide psychological first aid, and effectively communicate with individuals experiencing crisis-related trauma. In simpler terms, one should recognize signs of distress, actively listen and communicate, and offer psychological first aid techniques. A few key benefits in support systems are reduced stress and burnout, improved performance, increased recovery, and access to necessary services such as housing, assistance, and healthcare. It's important to implement support systems within organizations and communities such as peer support programs where responders can seek assistance from colleagues who understand their experiences. Having mental health professionals available on site to provide immediate support and interventions, and establishing hotlines or helplines for responders and community members to access assistance when needed. Now moving on to community-based interventions. Reasons why community-based interventions are important are there is a cultural relevance and sensitivity, accessibility and reach is enhanced, reducing transportation barriers and unfamiliarity, and it gives a sense of empowerment and ownership for their collective well-being. More deeply for the types of community-based organizations, engaging in community-based organizations aimed at providing psychosocial support, such as support groups where individuals can share their experiences and receive support from their peers, community resilience initiatives that strengthen social connections and promote coping skills, and incorporating cultural and spiritual support into response efforts to meet the diverse needs of affected populations. Proceeding to promoting self-care among responders. So for one, we have the importance of self-care for mental well-being. Self-care practices are important in preserving the mental health and well-being of emergency responders, acknowledging that caring for oneself enables responders to better serve others and sustain their resilience in the face of adversity. For number 2, we have emergency responder self-care strategies, offering practical self-care strategies, including setting boundaries to maintain work-life balance, practicing mindfulness and relaxation techniques to manage stress, engaging in regular physical activity and exercise to promote physical and mental health, and seeking social support from friends, family, and colleagues. And last but not least, number 3, for building a supportive workplace culture, we must advocate for a supportive organizational culture that prioritizes the well-being of responders, including implementing flexible scheduling to accommodate rest and recovery, providing access to mental health resources and support services, and conducting debriefing sessions after critical incidents to process emotions and share experiences in a safe and supportive environment. Now for our last topic, we have fostering resilience among responders and community members. We'll touch base on the definition of resilience. Resilience is the ability to adapt and bounce back from adversity. Resilience is relevant in crisis response where individuals and communities face significant challenges and disruptions. In order to build resilience among responders, there are a few key points we must remember. Provide training in resilience building techniques such as stress management workshops and resilience training programs. Cultivate a sense of purpose and meaning in their work. Highlight the importance of the role that others and highlight the importance of their role in helping others and contribute to the community. And lastly, recognizing and celebrating success and milestones, which is acknowledging achievements, no matter how small, to bolster morale and motivation, and hold regular appreciation events to recognize the hard work and dedication of responders. Just a few questions to ponder on a recap of key points in this presentation. How can understanding the psychological and emotional impact of crisis enhance our response efforts? Why is promoting self-care crucial for the resilience of emergency responders? What are some effective strategies for providing psychosocial support to both responders and affected communities? With collaborative effort, psychosocial support requires collaboration among various stakeholders, including emergency responders, mental health professionals, community leaders, and government agencies. We must prioritize our own mental health and well-being and remember that taking care of ourselves enables us to better support others. By supporting one another, we can build stronger, more resilient communities capable of overcoming adversity. Thank you all for listening.
Thank you. Thank you so much, Vanessa. Thank you, Vanessa Ferguson and Frank for Rockaway, Arverne Nonprofit Coalition. Thank you for adding to the discourse on mental health by highlighting the importance of providing psychosocial support for emergency responders. Thank you so much. For those that have questions, again, please put them in the chat. We're documenting them. If you have any questions about links or resources she referenced, please utilize the chat for that. So our final presentation, for our final presentation, I would like to introduce LES Ready, led by Executive Co-Chairs Damaris Reyes and Io Harrington. LES Ready is a coalition dedicated to disaster preparedness and community resilience on the Lower East Side. Formed in the aftermath of Hurricane Sandy, the coalition works to ensure the community is equipped to handle future emergencies by engaging in community outreach, providing education on emergency preparedness, and collaborating with key stakeholders to develop and implement response plans. Please join me in welcoming the representative from LES Ready.
Good morning, everyone. So my name is Ella Butler, and I am the disaster coordinator for the LES Ready Coalition. I came to LES Ready just about a year ago with a background in disaster management and emerging technologies. So technology is really at the forefront of all the planning we do at LES Ready. I chose the topic for today's presentation because I know there's a lot of language and rhetoric out there about artificial intelligence that can be a bit intimidating. So today I just wanted to talk a little bit more about how AI is already being used in New York City to mitigate multiple risks and ways in which we can harness its power to predict the future. New York City's densely populated urban areas are particularly vulnerable to climate changes. As climate-related risks increase, AI becomes a critical tool in our city's resiliency efforts. Urgent climate-related challenges demand proactive measures and innovative solutions to protect its residents and ensure a sustainable future. As one of the most densely populated coastal cities globally, New York City grapples with the imminent threat of rising sea levels, bigger storms, and increasing temperatures. According to projections by the New York City Panel on Climate Change, sea levels are expected to rise between 8 and 30 inches by the 2050s, and potentially as much as 15 to 75 inches by the end of the century. This alarming trend amplifies the risk to the approximately 1.3 million residents currently living within or directly adjacent to New York City's floodplain. As climate change intensifies, the urgency lies in safeguarding lives, livelihoods, and the city's future. As one of the most densely populated coastal cities globally, New York City, sorry, my computer's trying to catch up. Artificial intelligence is technology that enables computers and machines to simulate human intelligence and problem-solving capabilities. On its own or combined with other technologies like sensors, geolocation, and robotics, AI can perform tasks that would otherwise require human intelligence or intervention. Digital assistants, GPS guidance, autonomous vehicles, and generative AI tools are just a few examples of AI that we're already currently using in our daily lives. New York City has been at the forefront of leveraging artificial intelligence to enhance its resilience to climate disasters and improve emergency response by using predictive analytics for climate modeling, smart infrastructure modeling, emergency response optimization, and risk assessment and vulnerability mapping. Let's look at how New York City is harnessing the power of AI to better predict, prepare for, and respond to climate disasters and other emergencies, ultimately making the city more resilient and safer for its residents. New York City's biggest vulnerability to climate disasters stems from its coastal geography and dense population. Storm surge modeling is a critical aspect of our disaster preparedness, especially for coastal climate cities like ours. To address these vulnerabilities, New York City applies a variety of AI-powered predictive modeling and simulation techniques to forecast storm surges more accurately. By integrating historical weather data, oceanographic information, and geographic data with AI algorithms, the city can simulate different storm scenarios and predict the potential of storm surges on coastal areas with greater precision. The city also utilizes data analytics and machine learning algorithms to analyze vast amounts of meteorological and oceanographic data in real time. These AI-driven systems can identify patterns, trends, and anomalies in the data, enabling meteorologists and emergency planners to make more informed decisions and issue timely warnings and advisories ahead of impending storm surges. The value of real-time information is undeniable. AI is integrated into the city's early warning systems to provide timely alerts and notifications to residents and emergency responders in areas prone to storm surges. By analyzing real-time data from weather stations, tide gauges, and other sensors, AI algorithms can detect changes in sea levels and atmospheric conditions indicative of impending storm surges, triggering automated alerts and evacuation orders as necessary. These AI-driven approaches enable New York City to better predict and prepare for storm surges, mitigate their impact on coastal communities, and improve emergency response efforts during extreme weather events. New York City, with its extensive coastline and low-lying neighborhoods, faces recurrent flooding not just due to storm surges, but also heavy rainfall and rising sea levels. To address this challenge, the FloodNet initiative has emerged as a collaborative effort among academic institutions, government agencies, and community partners. FloodNet deploys a network of ultrasonic sensors strategically placed in street-level flood-prone areas across the city. These sensors continuously collect real-time data on water levels, which is then visualized on an interactive map accessible to the public. By leveraging generative AI, this system provides timely alert to residents, emergency responders, and city officials about rising waters. This AI-driven approach enhances situational awareness and enables proactive responses to flooding events. Early detection of floods in New York City tunnels is hopefully the next vital step in this process. New York City's subway system is a lifeline for millions. It's vulnerable to flooding during extreme weather events, and flood sensors in subway tunnels could provide valuable real-time data to monitor water levels and detect potential flooding incidents. The age of the subway structure, designed without even considering sea level rise or torrential rains, exacerbates the risk. However, this is where AI technology could really make an important impact. For instance, the California Department of Forestry and Fire Protection uses AI-powered image recognition to identify wildfires even before human observations notice them. Similarly, New York City subway system could benefit from its technology to immediately detect water accumulation in tunnels. Researchers are also exploring predictive models that will consider weather patterns, historical data, and real-time sensor inputs to anticipate subway flooding. By analyzing data from drainage systems, ventilation grates, and electric cable entry points, AI can provide early warnings to subway operators and maintenance crews. Such insights allow for targeted interventions such as deploying sandbags or activating pumps to prevent or mitigate flooding. As New York City faces more frequent and intense heat waves due to climate change, accurate forecasting becomes paramount. AI models combined with climate simulations offer valuable insights. Researchers at MIT have developed an algorithm that corrects coarse climate models by nudging them towards more realistic patterns. By pairing these corrected models with finer resolution models, they achieve a more accurate prediction of extreme weather events. This approach helps New York City estimate how often specific locations within the city will experience heat waves as temperatures rise. Such forecasts empower emergency management agencies to prepare for extreme heat events. As we know, not all neighborhoods face equal risk during heat waves. The Heat Vulnerability Index, developed collaboratively by DOHMH and Columbia University, assesses the risk of heat-related mortality across New York City neighborhoods. By analyzing historical heat-related deaths, the HVI identifies areas with higher vulnerability. These areas can be neighborhoods that lack air conditioning, have older populations, or face socioeconomic challenges. New York City could expand on its use of AI technology by implementing smart cooling systems. AI-powered smart cooling systems can optimize energy usage and indoor climate control in buildings and public spaces. These systems use sensors to monitor temperature, occupancy levels, and energy consumption, adjusting cooling settings dynamically to maintain comfort while minimizing energy waste. In New York City, deploying AI-driven smart cooling systems in public buildings, transit stations, and outdoor recreational areas can provide not only relief during heat waves, but reduce the strain on the power grid. New York City's critical infrastructure, including bridges, tunnels, and high-rise buildings, requires continuous monitoring to ensure safety and prevent failures. AI-driven systems play a pivotal role in this regard. AI algorithms currently analyze data from sensors embedded in bridges and tunnels across the 5 boroughs. For instance, the Verrazano Narrows Bridge, connecting Staten Island and Brooklyn, employs strain gauges and temperature sensors. These sensors feed real-time data to AI models that detect anomalies such as excessive vibration or stress. Early identification of structural issues allows for timely maintenance and prevents catastrophic failures. AI-powered surveillance cameras monitor New York City's iconic skyscrapers, assessing factors like movement, cracks, and corrosion. For example, the Empire State Building uses computer vision algorithms to detect signs of wear and tear. By predicting maintenance needs, AI helps extend the lifespan of these structures and ensures public safety. AI also enables predictive maintenance in the New York City subway system by analyzing historical maintenance records, weather patterns, and sensor data from tracks and trains. New York City's Con Edison power grid relies on AI to predict transformer failures by analyzing voltage fluctuations, load patterns, and temperature changes. While AI offers immense benefits, ensuring data privacy and transparency in AI algorithms is essential. Balancing these benefits from potential risks remains a high priority. New York City must strike a balance to maximize advantages while minimizing potential risks. AI systems rely on vast amounts of data to make informed decisions. However, handling sensitive information during disasters raises privacy concerns. Ensuring that personal data such as location, health records, or emergency contacts remains confidential is crucial. New York City's Emergency Management Department is actively collaborating with stakeholders, and the recently unveiled New York City Artificial Intelligence Action Plan outlines responsible AI deployment across all municipal services. It emphasizes transparency, privacy, and non-discrimination while harnessing AI's potential to improve residents' quality of life. So yes, AI offers immense benefits, but over-reliance on automation may lead to unintended consequences or errors during critical moments. This is why New York City's adoption of AI for disaster preparedness requires a thoughtful approach that respects privacy, promotes transparency, and balances benefits with ethical considerations. By addressing these challenges, New York City can continue to harness AI's potential while safeguarding its most important assets, its residents. As you've seen, artificial intelligence is shaping New York City's response to climate and other hazards, and is a valuable resource needed for a resilient future. By integrating AI into emergency management strategies, New York City aims to enhance preparedness, response, and recovery during disasters. But let's not forget that our resilience lies in our collaborations. New York City residents and community organizations need to understand AI's role in preparedness and response. Education programs should be developed to train its citizens and community organizations on the use, risks, and implementation of AI applications. It is through this collective effort that New York City can lead the way in using AI to prepare for the challenges ahead, whether it's predicting sea level rise or anticipating extreme weather events like hurricanes. AI models can provide timely life-saving insights. By understanding vulnerability and exposure, we can continue to develop infrastructure that minimizes the impacts of hazards in our city and safeguards the lives of future generations of New Yorkers. Thank you.
Wonderful. Thank you, Ella. Thank you so much, LES Ready. Thank you, Ayo. Thank you for that great presentation. Thank you for taking the time to demystify the presence of AI and walk us through how artificial intelligence is being used in disaster resiliency, while also presenting the challenges and ethical considerations. Very much needed topic. Again, if you have any questions about any of the presentations, please put it in the chat. We welcome them. So at this time, a big thank you to all our CENs for presenting on relevant topics from financial insecurity all the way to analyzing the use of AI and climate resilience in New York City. Thank you so much. Let's give everyone a round of applause. Thank you so much. Thank you, everyone. These are the organizations that are on the ground, working directly with our communities to increase resilience, and working with us as well as partners. So we thank you. We acknowledge the rich competence and knowledge that they have within their communities. Now at this time, we have a few updates from other partners that are in the Community Preparedness Program. First, we'll start with Lucy Cummings. She's the Director of Faith Sector Resilience, who leads our work in the Faith Sector Community Preparedness Program through NYDIS, New York Interfaith Disaster Services. Our aim through them is to expand outreach to religious communities and houses of worship across the city in emergency preparedness and response. So she'll share a few updates in this landscape from NYDIS.
Good morning, everyone.
Great.
Yep.
Awesome.
Happy Monday. So Elise asked me to share a bit about a fairly new program that we have around climate resilience. So I'm just going to share my screen to bring us to our website. can folks see the NYDIS?
Yes.
Great. So since 2022, NYDIS has been focusing on climate resilience. And I think one of the, and doing that through developing a program that's focused on supporting New York City clergy and lay leaders to be trusted messengers and centers for support in this climate crisis. One of the questions that I'm often asked, and I'm just going to kind of start scrolling as I'm talking, is why are we calling it a climate resilience program? Why not just extreme weather? And I think the answer is that, when we focus on extreme weather or natural disasters only, it tends to give you the impression that this is out of our control, that the most we can do is to be reactive. And it was really important for us to focus on climate degradation as a crisis of justice, that the climate crisis has its roots in economic, racial, and environmental structural inequities. That it's a crisis of values. That when we're talking about mitigation, it's not only disaster mitigation, but we should be looking at carbon mitigation and lowering our environmental footprint. And I think the other piece for this, especially given our sector, is that it's important for clergy and lay leaders to prepare for the emotional and spiritual support that folks, especially young people who are experiencing climate anxiety and climate fear, are experiencing. We were also very interested in breaking down the silos between climate justice networks and communities, not only to kind of build bridges, but also for our sector to access resources and to share capacity on a lot of these issues. And I think for many of us here, oftentimes we don't see disaster activism sometimes in these climate justice communities. So what are we doing? Well, we're doing a lot of training. We'll be having a Lunch and Learn webinar series throughout the year. We will be hosting on-site workshops, and if you were to go through the pictures of this program, you would see many of you, because many of these workshops are done in collaboration with local community partners. And many of you are in the environmental and climate networks that we're active in. So the workshops are really helping faith leaders to identify the work of your organizations, many of whom might not be familiar with the incredible local organizations on the ground. We also have annual convenings, and focusing on climate justice will be a big part of that, has been and will be. And then I think coming forward, one of the gaps that we often hear about is about facilities and the lack of funding and the lack of support for hardening facilities. So we're going to be developing low-cost DIY resiliency audits for houses of worship. And then finally, what's not here, but which is also very important, is around advocacy. One of the things that we'll be getting involved in more deeply is advocacy at the national VOAD level. And there are, of course, dozens of central equity issues when we're talking about climate justice. But just by way of example, the Stafford Act, doesn't right now, extreme heat is not an eligible disaster under the Stafford Act. So joint national advocacy on some of these issues will be an important part of the program. So we would love to work with you. As I said, a lot of this work, as with all of us, is building a neighbors helping neighbors infrastructure, and many clergy and lay leaders don't really know of the local partners on the ground. So we would love to try to continue to connect, to work with you for events and planning to support you, so that we can work together. So please reach out. I will put my email in the chat box, and I think I'll stop there.
Great. Thank you so much, Lucy, representing NYDIS. Thank you for the great resource. I have dropped that link, that climate resilience link in the chat for anyone that wants to dive in and join and read more about what's happening. Thank you so much. Okay. So as we stated, we just have some updates. Another update we have, our next update will be provided by Alana Tornello, Director of Resilience at the Human Services Council of New York. HSC, Human Services Council, leads our work in the human services sector of the Community Preparedness Program. Take it away, Alana.
Thanks, Elise. I'm going to put some resources in the chat for anyone that wants to follow along. So hi, everyone again. Alana Tornello. I know most of you here, but for those who I don't know, thank you again for having us. Really, it's always an honor to present alongside our community emergency network partners. And I really appreciate all the brilliant work shared today. For those new partners here, HSC is a coalition of over 170 human services providers focused on advocacy and coordination for the human services sector. Some of you might know us from our Just Pay campaign, which fights to end government-sanctioned poverty wages for human services workers. And we've seen a really large advocacy movement there over the last 3 years to address deep inequities facing hundreds of thousands of New Yorkers who serve communities and are themselves living below the poverty threshold. I know many of you who work in coalitions with human services providers are very familiar with that pattern. Others here might know us, probably the bulk of you know us from our work on the disaster resilience side over the last 3 decades, working with a lot of the CENs here and with New York City voluntary organizations active in disaster, especially through past disaster advocacy campaigns, trainings, and our nonprofit disaster resilience work group. And I'm giving that framing because I wanted to intentionally provide updates today in both the Just Pay side and the disaster portfolio, which we've really tried to merge more in our human services resilience agenda, which is ongoing advocacy to help human services workers better address the everyday emergencies with the large-scale disasters, which I think connects well to a lot of the themes you've already touched on among our colleagues here on Polycrisis. So yeah, updates on both. On the Just Pay side, the good news of this budget season was that the Just Pay campaign saw a 3-year cost of living adjustment, or a COLA, right? These are support to human services wages, and that was pledged and resulting in a total of over 9% increase for city contracted nonprofit human services workers on top of a workforce enhancement initiative. I know this is kind of technical. I'm happy to talk to people afterwards, but basically this was a big deal for us because it came after an aggressive advocacy campaign in 2023 that had over 6,000 human services workers out to rally, nonprofit leaders staying up overnight at City Hall in protest, directly advocating to legislators at City Hall and in Albany. But the fight absolutely continues. We didn't see this year what we demanded of the state. COLA is below what's needed, but our fight's not only about cost of living adjustments. We are very actively advocating now for the passage of the wage board bill, which would have the power to conduct public hearings, hold testimonies, and consult directly from the state side with human services workers to address longstanding issues in the sector. There's also so much more happening here, if I keep it short, but definitely would say also to check out on this front our rating of RFPs, where we try to identify inequities or risks that providers might be taking on, our advocacy related to contract delays, and also to cuts to human services, which I really do believe are a part of the polycrisis. So I think many would agree. So we're trying to bring those partnerships and advocacy methods from Just Pay also into the more kind of classic disaster resilience work too, although they really are, as many have noted, very much married, these issues. So we have a 6-point standing resilience policy platform. Basically, it's across disaster policy demands, the things we know come up over and over again. And we drew that from the last 2 decades of advocacy campaigns, but also from a lot of one-on-ones and really close chats with many of you all and other partners and HSE members. And so our first pilot of that platform is focused on equitable emergency procurement. And we've engaged with several city leaders on that initiative already, and we'll be working with many of you to bring these recommendations more locally this summer and fall. And then we've also created crowdsourced resilience roundups, which I've linked to. Those are focused on basically trying to, you all send wonderful resources out, and then we get resources from city and state agencies, and we tried to create a more live crowdsourced guide where we're really organizing those based upon crisis. And we love your feedback and collaboration on those. We have everything from flash floods to earthquakes in there, but we keep adding. And we continue to update emergency and COOP resources, and also are really trying to apply this to work that we're doing with coalitions focused on advocacy for new arrivals. And this includes New York CEN. So we're addressing specifically pieces related to inequitable impacts of the 30 and 60-day rules on new arrivals, working with providers, advocating for more coordinated and better funded care coordination, legal services, employment opportunities, and more in that front. And last, we hosted some great tabletop exercises this year with human services coalitions and providers who don't normally engage in disaster discussions. And we're really trying to get a few exciting projects out of that to better align with a lot of you here who have expansive experience in this area, have brought to the table. So try to get them more aware of all the resources that you provide and of conversations that are happening in spaces like this around polycrisis. So I put the links in the chat. If I have I don't know that I think I'm at time, Elise, right? But if I have a moment, I could share a link to our, or I could just show our website where the resources are.
Yes, you can continue.
Okay, thank you. So just to quickly show you where these resources are. So I would really, if you want to learn more about Just Pay, I'm showing a screen that shows the campaign. There's a lot of upcoming actions on here. We have a lot of calling and emailing campaigns. We do advocacy days in Albany and in the city. Sometimes it's also just a good opportunity for workers and staff to learn a little bit more about advocacy approaches. A lot of your staff and teams know about these already, but sometimes you might have newer staff that want to get, an experience in what direct advocacy might look like in these spaces. And we always encourage our partners to send folks through, and there's lots of opportunities to be part of that. And then on our website, the screen is still showing nonprofit disaster resilience page right now, right? It changed. I was just confirming. Yes. It said that now. Great. This has the resilience roundups I just discussed, the other trainings and resources, our campaigns, advocacy reports, and then the resilience roundup. Really would love all of your collaboration on this if possible. Right now, they're pretty long, but that's because we've been really compiling all the great information that you all send through. But we're really just trying to make a space for our providers to draw from when they're trying to figure out what resources to send out to their clients, patients, members, etc. So these are basically just crowdsourced guides. And there's lots more on the website, but just wanted to show you where those were in case you are ever looking for them. And thank you for including us here. It really is always wonderful to hear from you all and be a part of this community.
Thank you so much, Lana. You're no stranger to this space. I see you got a few shout outs in the chat already. We thank you so much for your partnership and the continued partnership through HSE. Okay, everyone. So we're going to transition to the Q&A section. We really just want to acknowledge some questions that came through the chat to make use of all of the knowledge that we have in this room. So we tried to just categorize them by topic. So the first one we're going to tackle is food insecurity. One of the participants asked, given it's a community of older adults, and I'm going to ask Esme to copy and paste the questions in the chat for everyone. Given a community of older adults, mostly in Brighton Beach, are there plans to address food insecurity for those who may be unable to get out of apartment buildings due to ability or flooding? Larissa, I believe you responded in the chat. I'm just going to repost your answer for everyone that wasn't able to read it at that time. And then if you want to elaborate, please do. The answer was, we have started a modest home delivery program that could potentially be expanded in such an emergency. We also focus on cultivating a large network of volunteers to support our work. Tapping into this group for added support may be possible. The Shorefront JCC is part of a number of food programming groups, including Food Bank of New York City, Met Council's Kosher Board Network, United Way, etc. And in emergencies, these groups mobilize to strategically and collectively address unexpected emergencies that arise. Thank you for answering that, Larissa. Is there anything that you want to add? Or someone from Shorefront JCC. Oh, we're not hearing you, Larissa, if you're trying to speak.
Elise, we as a Southern Brooklyn COAD, I mean, we collaborated, right, on this presentation with Larissa, and I mean, as to our knowledge and understanding, this is, you know, the information that we would like to share.
Great. Okay. Thank you. Thank you.
Yeah.
Okay. We have some other food insecurity questions, focused questions. Laura, this is to Laura and Larissa. Are you all creating relationships with higher ground partners to support folks in the case of flood disasters?
Yes, in fact, we have a directory of members as well as other organizations. If you went to our website of Southern Brooklyn COAD.org, you would see that there is a map there. That map is being updated, but basically it is the directory of different organizations that we are in touch with, and we try to think about all phases of disaster preparedness as well as response as well as recovery, with the idea that any organization that is approached by a resident who has been impacted by disaster is not a closed door. That if that organization itself cannot address the challenge of the resident, that the directory is there in order to be able to refer that resident off to other sources of information, and to do that in a way where it the languages of that resident are spoken, it is in close proximity to where that person lives, and so forth. So that's what we do in terms of our resource manual. Specifically, with regard to Larissa, she did put in her reply that she has relationships with Med Council and some other organizations that assist with setting the pantry up to be successful. But I can also tell you a quick anecdote that when there was a fire in one of the Warbest buildings, which if you ever went to Coney Island and look off to the right, after you go under that bridge by Brighton Beach, look off to the right, see all these white high rises. There, it was in the middle of the summer, and their air conditioner went out. And so what they wanted was for people not to need to cook. So we collaborated with several other large food providers, as well as the Red Cross, to bring in a team that could basically take the food that was donated, put it in packages, and then deliver it to the people in the building. So that, you know, it's not a fully extreme situation like a flood, but it's an example of how we can collaborate, you know, with a small group, to address a strong need, because they have a lot of seniors in that building and they just did not want them putting on, they didn't want them cooking, was the bottom line, right? So Larissa can provide more specific information about these other partnerships, but also the sequence when it comes to food insecurity. And I recall this happening after Superstorm Sandy, is that donations come in. They came in from all over. It was kind of a mess, as everybody knows. People send all kinds of crazy things, but there was food, for example, in Sheepshead Bay at a middle school, and we did try to direct people over to it, but there was no phone service. So personally, I actually went around on my bicycle telling people to go over to the middle school, that's where they could go. But the Red Cross came in about 3 days later, and they started to do mass feeding. And Occupy Sandy also came in, and they had pop-ups where they were taking food donations and distributing food. So mutual aid comes into play. We are in contact with some of those organizations, but those are very organic, right? They pop up in an emergency and then they fade away because they're not, officially nonprofits. So I hope that answers your question while we wait for Larissa to come in. I think she thought the Q&A was good.
No, I'm here.
Oh, you're here.
I was
Perfect.
having some technical issues, but just to add, for the Shorefront JCC, we used to be in a basement. So outside of weather, disaster emergencies, we also just faced, it snowed outside and water seeped in and our electrical panel got affected and there was no light or heat on a given day. So as part of our move in the fall of 2022, we moved from a basement floor to the 5th floor. So even though we're in an elevator building, there's also a staircase. So we should still be operable. I pray that it never comes to a situation where the waters are reaching our level, but these were some of the considerations that we were looking for in our move.
And also, I know that
thank you. We just have sorry, you have a question.
I was going to say, I know that also in a number of the NYCHA buildings, all the way on the western end of Coney Island, and this has happened since Hurricane Sandy and has just cost millions and millions of dollars, but that is to elevate the mechanicals, in I believe, including the elevator, so that at least, if they have a generator, the building has its own source of power, even if the grid goes down. And so people do not have to, who are bringing food, do not have to be going up and down 19 or 20 flights of stairs, which is what happened after Sandy, that elevator would still be working. And that's emergency preparedness, forward thinking, because those mechanicals are just critical. Thank you.
Sorry, and can I just add that in terms of the directory that Laura was talking about, we are constantly updating it and adding new members. So I am in charge of updating that directory. So I'm going to leave my email here. And if you can just email me, I'll be in touch regarding the partnership. So thank you.
Thank you. I believe we have a question from Lucy.
Hi, all. Thank you so much. We are trying to develop continuity of operations planning resources around flooding and encouraging houses of worship to kind of set up partnerships with higher ground organizations, even if it's just to store stuff, is always a bit of a challenge. So I would love to hear from you all, and thank you, Laura and Larissa, for what you've already described. Maybe not in this response, but maybe in the chat about what's worked. Are there kind of mutual aid agreements that you've had? How does the relationship building happen? I just would be really keen to hear from folks who have done it successfully. Thank you.
Please, CENs, feel free to jump in. You want to address Lucy's question?
So I can take a start. I would say just getting in on networks is really critical to have contacts know what other folks in the neighborhood are doing, what other organizations are doing, or what type of support they can provide in these types of emergencies. So just to pull an example from our presentation, when we started to see an influx of Ukrainians in the region, we didn't receive any funding to support this new population. But we mobilized our own resources, which included volunteers, our time, looked at what partnerships we already had that we can bring together to start and addressing the needs of this new and growing population. For an entire year, we didn't receive an extra dollar for this service, but what we were able to do is partner with the Jewish Community Council of Greater Coney Island, who had a COVID disparities grant and a team of community health workers in the local area that were able to be deployed and provided assistance for on-site services. They became our on-the-ground outreach team. We partnered with Department of Health on providing they reached out to us and said that, folks need to get tuberculosis testing within 90 days of arriving in this country. Would you be willing to be a host site? And we were back in November. I think we were their first host site. At the end of the event, they turned to us and said, would you consider doing this again? I think out of the 28 citywide health fairs that they hosted, I want to say 13 or maybe it was 18 were held at the Shorefront Jewish Community Council in partnership. And after the first one, where it was specifically targeting tuberculosis testing, and we paired it with our community health workers, so we offered COVID and flu vaccination at the same time. Over time, we expanded the resources that were provided at that time. So we opened up our food pantry on a Sunday because we saw that it was the most successful day in terms of getting people to come out and get that free tuberculosis testing. We reached out to partner organizations and said, hey, we have this captive audience that really needs services. Would you be interested in tabling? We brought in Russian-speaking volunteers and paired them with those that were tabling and, the clinic workers doing the testing to make sure that, our clients were understood, that information can pass freely. And that went on for over a year, a completely unfunded program, but responsive to the need in the community. That has helped us as an organization, strengthen our partnerships, strengthen who we are in the community, and how we're presented and what we're known for, and also what we're capable of, right? So it speaks to a lot of areas that CBOs, I think, can learn from.
Thank you, Larissa. Thank you so much. And we
just
have
wanna-
a question. Yeah, go ahead, Angel.
I just wanted to amplify Larissa's comments. We do a lot of in the moment response work, and as we did the same thing, Larissa and East Harlem, a year ago in August. We partnered with our home-based representative, NYCM, and others to distribute flood barriers, and actually have put that in the hands of community residents and business owners if they were, so that they actually had something to, in their hands to, in the moment, protect their home or their business. And I think what's missing is the upstream solutions to this that I think Alana has referred to, is like, what would it take for, our small businesses who may lease out particular properties, that integration of knowledge and practice is part of like the lease agreement. Like, here's a flood barrier. This is what it looks like. This is what may be needed. Same thing for our churches who are leasing in properties all over the city in these, random sort of locations that feel like, is it safe to even be in? And where's the accountability upstream? So I think that we need to think about more upstream solutions, because there's only so many of us that can run around on our bicycles and Miss Carol Johnson on her scooter getting flood barriers out to people.
If I could just add to what you said, Angel, the law has changed with regard to informing the public of whether a building has been impacted by a flood or not, has a flood history. Now, if you are selling your home part of you have to submit a disclosure that includes whether your home has been impacted by a flood or not. And that's a function of whether you have gotten funding, right, from FEMA or insurance. Second is it also passed now that when you get your lease is supposed to indicate if your building has ever been impacted by a flood. So these are now law requirements, both of home sellers and of landlords. So that's something that we can all advocate for.
Yeah, I think greater enforcement of those lease, for sure. And we're in a neighborhood that doesn't have a lot of home ownership. So it's different, but I appreciate your updating us. Thank you.
Thank you, Dr. Angel. Thank you, Laura. We don't have any more questions regarding this topic, so we're just going to shift over to just make sure that we can address some of the questions that came in. This is more under the financial insecurity bucket. I'm going to put these questions in the chat. Thank you, Lucy, for providing that link regarding flood risk. One of our attendees asked, getting real information on insurance is a nightmare. Many people don't know that basements are generally not covered under flood insurance. These policies are written by lawyers for lawyers. How can we work together to help our networks make sense of this? And this question was posed in the financial insecurity presentation.
Sure. So again, just piggybacking off of what was just said about floods and providing that information, but part of financial literacy is knowing what questions to ask, right? And having the confidence to ask these questions. And part of that is being able to weigh the cost and risk of things, right? So if it's worthy to have someone come in and assess to see if maybe this property has not had flooding before, maybe this potential things change with time, right? So is it worth having someone to come assess the risk? Is it worth now? You have to decide, okay, do I pay for the insurance and do I, or do I risk if something happens, am I going to be prepared for that level of damage, right? So everything is always the ability to weigh this risk. So with flood insurance, there's a different type of insurance. There's contents insurance and then there's building insurance. Do you need both? Or do you not store certain things down there? Or do you leave that limited so that the risk of things being damaged is decreased, right? So it's always this balance of figuring out what is the cost of not doing so or not getting it. But again, that ties back to financial literacy and being able to know, is it worth having someone to assess it? Is it worth having more collaborative efforts, like when people do first-time home buyers or even businesses, small businesses who are going to start, looking for property, having these seminars and collaborative efforts where it's not just focusing on credit, but having people who represent credit and financial backgrounds, who have insurance backgrounds, who have legal backgrounds, who can ask questions on behalf of people, not just lawyers for lawyers, because the language is always very obscure. And how dare we actually use the insurance that we're paying for, right? It's almost like you get penalized for doing that. They increase your premiums going forward, or sometimes you're not insurable anymore with them because you're actually utilizing it. So it's going to be assessing the risk, and maybe, this is not, if the risk is too high, then maybe this is not a good location to have such business or such home. You really have to weigh it out.
Thank you, Gloria. Thank you so much. Okay. We are going to, if anyone doesn't have any more questions regarding financial insecurity, we're going to shift a little bit to mental health support. It was a question that was posed in the chat. There was an answer, but we're going to address Vanessa and see if there's any more she can add. Do you find that there is resistance to first responders in working on their mental health? The response was, first responders are so caught up with caring for others, they lose focus on their self-care. As Vanessa mentioned, this is why it's paramount that families and CBOs are attentive to providing support. So I just wanted to defer to Vanessa or Deneen Ferguson, if you want to elaborate on this response.
Thank you, Elise. I am not a first responder, so I cannot give you any specific response to the questions or any personal accounts answers to the question. But I did post some links in the chat for the Psychiatric Times, the Spectrum Local News, and First Responders Foundations. These links have some articles on the topic of supporting first responders and the pushback on the mental health of taking care of the mental health of responders. I'm going to pin it right now so that you all can reach it. It should be pinned.
Wonderful.
you.
Thank you. Thank you, Vanessa. I believe we have a question from the audience. Oh, who's this? Oh,
Sorry,
okay.
Elise, it was my hand.
Okay, Michelle.
Yeah, I was just gonna chime in to take a very quick half step back on the flood insurance. I just want to shout out the South Brooklyn COAD really quickly. I know that, or I believe that I've seen that they circulate some workshops around flood insurance and things like that to really help residents understand and unpack that nuance a little bit. And so the question being framed is, what can we do collaboratively? I just want to shout out the Brooklyn COAD. I think they do a really nice job of getting that started, and something that is replicable in each borough if we all kind of choose to connect with our housing services providers. And again, to a point that we tried to really highlight is that cross-sector nature of planning and response, that when you engage folks in the private sector who are the lawyers and underwriters who prepare those insurance policies, bringing them into the fold can sometimes get the answers that folks are missing or that we simply don't have the expertise to have. And then I wanted to chime in on the mental health note about first responders and just kind of reemphasize the note about credible messengers. And I think that sometimes we hear that phrase and it becomes a little buzzy, and we put it in the lens of the underserved communities that we typically serve, or BIPOC communities who struggle to find access to care from BIPOC providers or clinicians, right? And so that's often when we say credible messengers or credible providers, I think, at least for myself, I default sometimes to that mindset. But that's true of subpopulations in general, and first responders are that. It is a unique job and role and responsibility and experience to be a first responder, right, by title, and for that to be your work day in and day out is intense and immense. And so there is something to be said for having clinicians and service provisions that are credible and relevant to those first responders themselves. A very small, anecdotal example would be, I know that I've been in a response mode with first responders, kind of around me. And there are sometimes anybody who's been in a response knows jokes, right? Something lighthearted or offhanded that might come out of someone's mouth that to others in the space could be taken really as insensitive or too off color for the moment, right? But that becomes a coping mechanism sometimes for those who are so deeply in the thick of it and have this vicarious trauma of their own. And that was something I learned in the way of just kind of cultural agility to be in that space as me, who I am with my day-to-day life, showing up and then listening and having to really be sensitive to and mindful of what are the strategies and realities for these folks that are around me who have a very different day-to-day than I do, and often a very different dynamic with the general public, right, than I do. And so I just think that, yes, it is a challenge to extend help and support to first responders. And there are organizations and training centers that do some specialized work in that regard. And that might, I know World Care Center is an example. That's a citywide organization that was founded post 9/11 specifically through or because of, I guess, their service provision to the first responders down at Ground Zero. And so I know they continue to really hold that close to their mission. But also here in Staten Island, for example, we have an emergency, I want to say it's ERT or EMT, Emergency Medical Training Center, Response Training Center. I'm a little off on the acronym, but in any event, they also do tailored and customized trainings, like train the trainers, but also supports, again, for those who are a little bit of a unique subpopulation, and that is folks who deal every single day with danger and disaster. So it's certainly a challenge, and I would encourage folks who are interested in supporting that network to maybe tap into some of those who are already, excuse me, experts or prioritizing that through their work.
Thank you, Michelle. And we'll just have a final comment from Dr. Angel.
Yeah, I just wanted to add to Michelle's comments. We also provided resources. My colleague Evie is going to put in the chat. We developed short videos in Spanish and English because at the height of the pandemic, the frontline responders were the CBO provider staff, and they were burnt out and done. And so we needed to figure out ways to provide short interventions during team meetings, staff meetings, support groups, you know, how to even just engage in the conversation of like, what is trauma? So we hope that these are very plain language, user-friendly videos. They're all free. They come with guiding resources to download. We hope that you use them.
Wonderful. Thank you. We actually do have one more space for one more question. And we'll take that now. Thank you guys for staying engaged with us and for our CENs for engaging in these questions as well. Again, they've been providing their contact information. If you want to dive deeper into their work or have specific questions regarding their neighborhoods, we have the East Harlem COAD represented here. We have Southern Brooklyn COAD, Staten Island COAD, FRANC representing for Rockaway, and LES Ready representing Lower East Side. All right. Okay, thank you so much for a robust conversation and a wonderful, wonderful conference. I'm going to hand it over to my colleague, Esme Helta, for closing remarks.
Hey everyone, my name is Esmeralda Huerta. My pronouns are she, her, hers, and I've worked at the health department for about 1.5 years now. I work with Elise in the Community Preparedness Program, and it is such a pleasure to support these community emergency networks and the work that they do. They work hard. I'm just going to say that. And I'm always very impressed, and I feel really honored to be able to learn from the folks who are doing this work on the ground. So thank you again, not only for these presentations, but the work that you do. I'll be following up with contact information and the resources that have been posted on this chat. And thank you all for attending this wonderful conference. A lot of work went into this, and so it's really awesome to see that we hit our attendee goal and that we have this space to learn from one another. I'm gonna kick it over to Lou Rivera for closing remarks. Lou, let me know if you're able to join.
Hi, good afternoon. Can everyone hear me?
Yes.
Hello?
Yes.
Can you guys can hear me? Okay, great. I just want to, one, say thank you to all of the partners that worked with us on this event for your commitment to putting together some great material to discuss how we can, new ideas and concepts on how we can continue to prepare our communities for emergencies. So thank you so much. Never did I think I would hear something around AI in an emergency management type training. So it was really interesting to begin to discuss what AI means for us and how we can incorporate that into emergency preparedness. So that's just, one of the things that stood out for me in this conference. But many of you did some really great material, presented on some really great topics and materials. And I just want to say thank you to the partners that continue to come to the table, that continue to come up with ideas on, to how to best disseminate information and get it out to our coalitions and our partners. I'm super excited about the evolution of our CEN conference. This is the 3rd year we've done this, and it just gets better and better each year. So you guys should really be applauding yourselves and taking the time to be proud of what you've achieved in this particular conference and what you've managed to do, with not too much resources over the last 3 years to have this conference in place. So I just want to say thank you. I'm always humbled by the fact that we started the community preparedness program almost about 8 years ago. We started in the human services sector and the faith sector, partnering with both HSC and NYDIS. Shortly after, we brought in our community leadership sector and began partnering with many of the established COADs and community emergency networks. And so to see the evolution of the community preparedness program and all the work that has went into it, and sweat and tears and dedication, I'm humbled by you all. And I hope that when you walk away from this conference today, that you understand the importance that you all play in doing this work. Government, and I say this to you guys all the time, and I truly mean it, government could never do this work alone. And we could certainly not do it without many of the partners that are here today. And when I'm sitting in spaces where I have the ear of leadership, I elevate this all the time so that they understand what you all bring to the table and how you all help to not only prepare your communities for emergencies, but how you help prepare New York City government for emergencies, and particularly when engaging with human service organizations and houses of worship and communities across New York City, and some of the most impacted and disproportionately impacted communities across New York City. So I just want to say thank you. I am looking forward to what next year will look like. It is our goal to have this, hopefully this conference in person one day, to have additional resources allocated where we could bring in some more expertise, potentially from around the country, to kind of come and speak to our coalitions, your coalitions. And so I look forward to what this is going to look like in the future. This was the first year we actually promoted it alongside as a Department of Health initiative. We sort of kept it the first 2 years under our Community Resilience Planning Collaborative, so an attachment to that. But moving forward, my goal is to work with our Assistant Commissioner, who I believe you met this morning, Tamer Hadi, as well as our Deputy Commissioner, to really institutionalize this event into OEPR and into the health department. So if you're all willing to take the ride with us, then let's do it. And hopefully next year we'll be having even a more broader reach into doing this conference. So just thank you all. HSC, NYDIS, LES Ready, East Harlem, South Brooklyn, Staten Island, and FRANC. I appreciate you all.
Thank you. And on that note, have a great rest of the day, everyone.
Bye. Thank you all for attending.
Thank you so much.
Bye.
Have a great day.
Thank you very much. Bye-bye.
Thank you all. Bye-bye.